News Panorama is a TV news magazine program that gives you the story behind the story.
It tells the stories the way they should be told by capturing the larger scale.
It deals with people's deep feelings on issues that, when brought to the fore, ultimately educates, informs, and entertains.
News Panorama. Capture the larger scale.
This week on News Panorama, we take a look at medical areas, Cross River State Governor's visit to the fire incident area, students' loan, and the rains. I am Josephine Efanga.
News Panorama. Capture the larger scale.
If you have just tuned in, you are watching News Panorama. Since 2005, over 2 billion insecticide-treated nets have been distributed worldwide to prevent malaria. However, as mosquitoes in many areas are now resistant to pyrethroids, nets treated with other active ingredients are needed to prevent malaria. Insecticide-treated bed nets, ITNs, are a form of personal protection that has been shown to reduce malaria illness, severe disease, and death due to malaria in endemic regions. In community-wide trials in several African settings, insecticide-treated nets were shown to reduce deaths of children under 5 years from all causes by about 20%. Nets may vary by size, shape, color, material, and treatment status. Most nets are made by polyester, polyethylene, or polypropylene. Only 2 insecticide classes are approved for use on insecticide-treated nets: pyrethroids and pyrethroids. These insecticides have been shown to pose very low health risks to human and other mammals, but are toxic to insects and kill them. Previously, nets had been treated every 6 to 12 months, or even more frequently if the nets were washed. Nets were treated by simply dipping them in a mixture of water and insecticide and allowing them to dry in a shady place. The need for frequent treatment was a major barrier to widespread of insecticide-treated nets in endemic countries. The additional cost of the insecticide and lack of understanding its importance resulted in very low treatment rates in most African countries. Recent studies have suggested that the rise of pyrethroid resistance may undermine the effectiveness of nets. To help manage resistance, some net products incorporate piperine botuliside (PBO) along with pyrethroid insecticide, but there is not yet evidence that this significantly improves insecticide-treated nets effectiveness in areas with high levels of pyrethroid resistance, and WHO currently does not consider nets that incorporate PBO to be tools for managing pyrethroid resistance. In 2017, WHO started to recommend a new type of insecticide-treated net that combines pyrethroids with piperine botuliside (PBO), a chemical that enhances the potency of pyrethroids against resistant mosquitoes.
You have to let them out for 24 hours, and then after that you can use them. There's no harm, there's no risk associated with it. The mosquito is a lot more dangerous than the nets, and people need to really, if they feel uncomfortable, they can go out, of course, but I think they need to understand how much protection they are getting from the nets, particularly the young kids and the pregnant women.
These medical experts throw more light on the importance of mosquito-treated nets and its health benefits to humans, including children.
Apart from the prevention which you get through the nets, there are also other processes where we're also trying to also prevent malaria. And so we know that malaria is caused by the mosquito. And so first thing is that if you want to prevent malaria, prevent the bites. The bites by them. And so that is what we think the nets will also do. So it prevents you from getting bitten by an infected mosquito. So it's not just any mosquito, an infected mosquito.
Okay, so one of the things is that a lot of people do not adhere to the proper way to use the nets. So one of the things we do is to sensitize people on how to make use of the net. So of course, this is a net that is called insecticide-treated nets. So there are chemicals in the nets that are being used. So the first thing is, when you get your net, you are expected to air your net under the shade for 24 hours. A lot of people do not do this process, and of course they come back crying foul with all the issues. So once you get your net, you air it under the shade, not inside your house, but not under the sun, but under the shade, where you can have cross ventilation to be able to, something that have been packed for a period of time. So once you're able to air it for 24 hours, you hang it on your bed tuck it under, and then whenever you can sleep inside and you're sure that you're fine.
We know that a lot of particularly children, pregnant women, are the most affected, when it comes to malaria infection. And that's why this campaign is targeting and ensuring that every household in Cross River State can have access to insecticide-treated nets. We're currently over 2.5 and about 2.78 million, nets are going to be distributed in Cross River State. And we expect that every household should have at least one net. And of course, expect that they should sleep in the net to protect the family and protect the children, because prevention is indeed most important.
For CRBC News Panorama, Josephine Efanga reporting. Malaria is a serious and fatal disease caused by parasites that commonly infect humans, making them very sick with high fever and flu. Inyang Basi tells us more.
Malaria remains a major health problem in many parts of the world, including sub-Saharan Africa. It is a vector-borne disease caused by intercellular parasites of the genus Plasmodium, and it's mainly transmitted into the human blood by the bites of female Anopheles mosquitoes, who feed for survival and the production of eggs. Thereby, the infective sporozoites from the salivary glands are passed to the human circulation system and multiplied inside its red blood cells. Other mechanisms of malaria transmission are via blood transfusion, and congenitally, children under 5 years of age are most vulnerable to malaria, as it's also the case for other vector-borne diseases. Additionally, malaria remains a major cause of perinatal mortality, maternal anemia, and low birth weight. Malaria is a major health problem, causing 241 million cases worldwide in 2020 and 627,000 deaths. This disease is endemic in 87 countries, and World Health Organization (WHO) African region accounted for 95% of the global cases in 2020. The Deputy Governor of Cross River State, Right Honorable Peter Odey, said that malaria has lived with us for decades, charging medical experts to take responsibility and come out with a permanent cure for malaria.
Today we will launch the distribution of 2,797,350 insecticide-treated nets to households in the state. This net has proven to be one of the most effective tools in malaria prevention, providing physical barrier against this disease-carrying mosquitoes. Malaria, like you all know, has been a monster that has been living with us for a very long time. As we speak, as we sit here, as we stand here, someone somewhere will soon die of malaria. And if we don't take the responsibility, no one is going to do it for us. So we want to thank our partners for providing this net that will help to reduce the spread of malaria in Cross River State.
The wife of the Cross River State Governor, Mrs. Elvert Bassey Otu, stated that despite the fact that malaria is preventable and treatable, it has remained a big health challenge in Nigeria and Cross River State.
Malaria, as we know, we are here in dual capacity, talking about malaria as well as maternal and newborn and child health. Malaria, as we know, is a life-threatening disease caused by parasites that is transmitted to people through the bites of infected female Anopheles mosquitoes. Retention and use of insecticide-treated nets has remained the most cost-effective and easily deployed method for malaria prevention, resulting in significant reduction in malaria-related deaths and disability over the years. The distribution of these nets in Cross River State will ensure universal coverage of the populace in the state.
Some health development partners, including the State Coordinator for PMIS, Mr. Victor Bassey, and Breakthrough Nigeria Limited, Pascaline Edem, among others, all attested that malaria is still one of the key killer diseases in the world, adding that preventing mosquito bites is a very primary way to preventing malaria infection.
Once the pregnancy is after 4 months, and they take SP, the Fancida or Amala, all the other drugs that you guys know, that is the 3. And so we also use that to also prevent malaria. So that is called drug-based prevention. drug-based prevention of malaria. So you use SP and you give it to that pregnant woman so that that woman does not also have malaria. So you prevent the woman from having malaria, and also prevent the child in the womb also getting malaria.
Yes, so to every mother, first, one of the things we do for pregnant women is to ensure that every pregnant woman registers early for ANC. And why? It's called antenatal care. So there's a lot of care. The woman is provided with IPT, intermittent preventive therapy, for pregnant women to prevent malaria during pregnancy. And of course, so she has what we call, so that's SP that she takes. She takes it throughout the pregnancy period. And then when the mother eventually has the baby, we encourage that the mother and the baby should sleep inside the ITM. That way we prevent the bite of mosquito, and of course that way we not come down with malaria.
So I think you need to be cognizant of the fact that mosquitoes actually are the reason why you get malaria, and that pregnant women and children and people with compromised immunity should sleep under bed nets.
So a lot has really gone in, in the preparation for this campaign, and I must also thank all the partners that have supported the state, because there've been a lot of trainings, there've been a lot of reaching out to all the key stakeholders, including traditional religious leaders. Everyone is on deck. Every hands are on deck to make sure that we have a very successful campaign in Washington State. So of course, people have been trained already. A lot has gone in. They've gone to various people's houses. They've done a lot of registration, dropped some cards, which people are expected to use them.
Some mothers emphasize the need for women, especially pregnant and nursing mothers, to avoid mosquito bites, which causes malaria, by ensuring that families sleep under the net. They also expressed gratitude to the state government and development partners for their consistent sensitization on malaria prevention and control.
For me, my daughter had a baby net, so actually I do put her inside there and she will sleep. So I have one of the old mosquito net in my house and they use it together. They should go out and get the net when the net is available. Then they should use it to prevent they should use it to prevent malaria, so that their children will not get infected and them too, they will not get infected.
For CRBC News Panorama, I am Odey Bassey.
Globally, over 125 million pregnant women are at risk because of malaria infection that leads to the high child mortality and maternal rate that is up to 200,000 infants deaths and 10,000 maternal deaths occur annually due to malaria in pregnancy. Blessing Bassey has the details.
According to data, Nigeria is a country of the young with almost half the entire 180 million strong population, 46% currently under the age of 15. The current total for children under the age of 5 stands at nearly 31 million, while each year at least 7 million babies are born, while a little over 1 in 3 of Nigeria's whole population live below the poverty line. Among children, this proportion surges to 75%. When considering the low level of birth registration in some areas, up to 62%, known data about child health issues are likely to underestimate the true scale. A 2016 national campaign linked to healthcare services resulted in the registration of about 7 million children, but large population growth is impacting progress. Research revealed that in Nigeria, about 40 million women of childbearing age between 15 and 49 years of age suffer a disproportionately high level of health issues surrounding birth. While the country represents 2.4% of the world's population, it currently contributes 10% of global deaths for pregnant mothers. Latest figure shows a maternal mortality rate of 576 per 100,000 live births, the fourth highest on earth. Each year, approximately 262,000 babies die at birth, the world's second highest national total. Infant mortality currently stands at 69 per 1,000 live births, while for under 5s it rises to 128 per 1,000 live births. More than half of the under 5 deaths, 64%, result from malaria, pneumonia, and diarrhea. Investment in this sector has been high in recent years, although the proportion of patients able to access appropriate treatment remains low. Nigeria still has one of the highest mortality maternal rates in the world, as the figures varies between 800 to 1,000 live births based on the geographical location. The main causes of child mortality rate is identified as infection, malaria, anemia, unsafe abortion, HIV and AIDS, amongst others. A medical expert, Sir Felix Edem, attributed most of the mortality rate to malaria and diseases, advising pregnant women and nursing mothers to always sleep under long-lasting insecticide-treated mosquito net to reduce the malaria and maternal mortality rate amongst them.
In fact, it's ongoing very well. The turn-up is encouraging, but we only give to those who has the net card, who have already collected the e-net card. Those who do not have e-net card are not given. We also, with the maternal and child health that are integrated into it, we really focus also on the pregnant women and the children under 5, because those one on the child welfare day, clinic day of our children, which was on Wednesday, a lot of them were here, and we distributed net to those mothers.
Some nursing mothers explain that mosquito-treated nets are safe for use as a personal preventive measure during and after pregnancy, as well as antenatal checkup, are one of the most effective and clinical acceptable tools for prevention of malaria during pregnancy and maternal mortality rate in the state and country at large.
All women go for antenatal care because it reduces the rate of sickness for the baby, and it also reduces the mother from having so much stress when it comes to the delivery period, and it also reduces a lot of problem before you give birth or after you give birth. It can help you have a healthy baby.
It's very necessary because of giving birth at home is risky, not coming to antenatal, that one too is risky. But by you coming to a hospital, that is when they will educate you, tell you how you should go about it. If you feel things here, at least you know what to do. Or any sign you run to the hospital. But by you sitting back at home, you might not know whether the baby is even kicking well, whether it's still alive. By then come here, that is when they will know their stuff. When you wake up, they will know maybe they have malaria, other HIV, all this kind of infection. Because infection when they wash with rice come about the baby. Wash with rice even cause stillbirth. But by you coming, you know that they don't have to push for so long. Maybe they will know that yes, this person is qualified for that level. So
other medical experts, including nurse Lydia Efiumju, said to address the challenges associated with the delays which prevent women and child from receiving adequate, timely maternal health care, it is vital to prevent unintended pregnancies. All women, including adolescents, need access contraception, safe abortion services to the full extent law and quality post-abortion care.
Child mortality rate is known as the number of birth children recorded in a year. Children who are under 5 years, the death of children under 5 years recorded in a year. And also we have what we call maternal mortality rate, which is the death of pregnant women that has been recorded in a year.
Why we give the pregnant women the nets is to prevent them from having a mosquito bite, which leads to having the malaria. So it will help them, and we have advised them not to use it and plant their water leaf. They should use it for the purpose that this net is meant for.
because the children, the immunity of children is low, to use and protect the children against malaria. They should check their environment. There should not be stagnant water.
For CRBC News Panorama, Blessing Bassey reporting.
The Cross River State Governor, Prince Bassey Otu, has promised to build a modern palm oil market in Bogobori area of Calabar for palm oil merchants and consumers. The reports. The Governor, Senator Bassey Otu, has donated 10 million naira to shop owners whose stores were gutted by fire at the Bogobori area in Calabar. The Governor made the donation when he visited the fire incident site along Barracks Road, Calabar. Governor Otu, who sympathized with the victims of the inferno, assured that his administration will erect the structures for the ultra-modern palm oil market in the affected area. According to him, government is deeply touched by the extent of destruction, adding that it is unfortunate and sad that the incident happened under the current economic hardship. The governor, who was accompanied by his deputy, Right Honorable Peter Odey, the Speaker and members of the House of Assembly, as well as other principal officers, assured that government will continue to support them. The government said it is putting structures in place for the states to function optimally.
As a government, we are indeed very sad with what has happened here. For people who have never been here before, they will not know the extent of this carnage. This is very serious, considering that this is the center of trade of the Hausa community in this capital. It is very unfortunate. But in life, we must have incidences like this. We are coming at this time to support you and to let you know that the government is going to be behind you in all that has happened here. For today, we'll immediately make available the sum of 10 million naira. And then we will quickly help in erecting these stores back. For those who have lost almost all they have here, I will say so long as there is life, there is hope. And God, the Almighty Allah, will provide again.
The head of Hausa Fulani community, Alhaji Garba Lawal, in his remarks, expressed gratitude to the governor for visiting the scene to see the level of destruction. He said, though no life was lost, the fire which caused is yet unknown, has destroyed properties worth millions of naira.
The whole community was engaged. We're all engaged into the mosques, and the thing started, I think, from the end shop of the roadside, one of the shop. I think we don't know the cause of the fire, either electrical or the gas flaming and all that. Because since nobody is in there and it's afternoon, I think we can't give a stated reason why the fire outbreak comes. But before we could try one or two efforts and see how the incident could be rescued, a lot of damage has already been done. Even when the fire service came and tried to do one or two efforts, still they could not rescue the situation to a point. But at least.
For CRBC News Panorama, Josephine Efanga. In Cross River State, the rainy season is a blessing to farmers. This is a period where cultivation of farm products takes place. As other business activities continues, many experience a downturn during this period. Idong Sedesian examines the advantage and challenges that comes with the rain. The report.
Rainy season in Nigeria usually starts from April to end in October. It's also called the wet season. It is the time for farmers to step up their agricultural activities, as planting during the dry season is most time difficult. However, in as much as the rain comes with its advantage in the planting process, what happens when the products are being taken to the market for sale? Mrs. Patricia said, despite the rain, a farmer will spend a day harvesting and preparing for markets, stand in the cold rain all day and only make half of the money that would have been made in a sunny day. Business in the rainy season, where goods are being sold, could be quite disheartening. Apart from the farm products, a sneak peek at other business and how they tend to thrive selling at this period.
As you can see, none is beating us. Market no dey. Joy no dey. Joy no dey at all.
When rain is
falling, you don't used to come out unless you are in the market when the rain is falling. If the rain is falling well, just cover your market. You not open because of the rain. People that is staying one place have customers because they stay one place. All that is hustling. Just anywhere you like, people that is in the shop, they have customers. All that like working around the road.
Well, some people wish the rains should go away because of the cold, flood and other discomfort it brings. Some small-scale business entrepreneurs would want the rain to continue in order to sell their various products. This business parades different products ranging from clothes, beverages, ointments, raincoats, as well as products that will help customers remain warm during the cold weather. As the products are meant to appeal all types of tastes and needs, these traders are never short of customers. For Mr. Samuel, a producer of nylon and shower cap, other business personnel said the season calls for creativity.
Season like this, I make corn because season like this, corn move on for us to use and buy whatsoever we wanted to buy. This is a time for corn business. We sell it and it's moving very well for me. This is what I've been doing every year, every season. This is what I've been doing. But now we are buying it 500 naira. So buying 500 naira, 150, 100 naira, that is how the business is going. Even though the rain is falling, I will still be under my rain. I will still do the business.
My business is not based on rainy season. Besides the shower cap issue, now most people are not even buying the shower cap. Most times you hear that I have it, I left it at home. Most times they just say give me customer bag. But actually me I like to give customer bag because I wanted to buy the shower cap. But we are still selling it and we'll continue selling it. But with or without the rainy season, some people still buy it maybe for swimming and other things.
Counting the advantage of the season, the shoemakers are not left out, as they disclose that the season usually brings more work for them, majorly in the area of polishing and repairs, as some people should get messy when they go through muddy and flooded area. Hence, the amount doubles this period. Every season has its peculiarity. You don't want to see the same reporting for News Panorama.
That is all we have on our lineup. We hope to be back same time next week. I am Josephine Efanga.